See,
It says my name on there.
so I can make this bigger if I want to, and I can see more of you all and less of the slide.
Don't hurry to get in here.
Oh yeah, so maybe I want to.
All the way there.
So,
You need to pick up this chair. Yeah, that's me.
Look how tall I look.
I always notice those things about myself too.
Should we put ourselves all at the same height?
Go down.
It's here. I don't want to do it to you when you drop your chair. It's right in front of us.
Yeah, take mine all the way down. Oh, no, mine all the way down.
Yeah, all the way down.
Rather see more of you all and less of the table. Now will that stay?
We can't, unfortunately, the arms on these chairs are ginormous, so we can't put it smushed together very closely. And do we want all these Surface Pros showing?
I would do one. This one I would remove, if that's okay.
So we can.
Oh my goodness, look what
Remote.
happened. Now we can see everyone.
Imagine that. I should have my water bottle.
I grabbed my water bottle in the car.
You're the one who was like, anybody want water?
Okay.
Oh wait, did we want to mute us now? So that
Why are
people, because anyone can
So
see
that
us right
if
now.
people logged in right now, they can see and hear what we're saying.
Oh,
So just mute us and turn the camera on.
And you're
So that should.
let's do a sound test. What do you think?
it's still saying you're the presenter.
Okay,
Control.
let me.
This stuff stressed me out because I don't know how to do any of this. Like, what's happening? Is it working? How do we know? Michelle, log in.
And then that way, if you guys want, I mean, it's close enough, you can just hit the enter key when you're
Is it
ready to
enter?
advance your
Is
slide,
that the one?
I usually.
Or arrow?
whichever. Wait, what does it say? Please close confidential windows.
This
Okay,
is like a warning. Close your email out.
Yeah.
I would
Waiting
just
to
turn
view-
Outlook off.
Waiting to view yours,
I'm trying to,
which means you
hang on,
need
I'm
to
just
have the
closing some windows.
PowerPoint up, open on this.
Oh yeah, you would have to have the slide deck open
From your email.
Ew,
Oh, but you had it. there.
this might not be the most current. Let me just go to email just to make sure.
Yeah.
That's still your screen.
Yeah, it's still showing my screen because I'm the one plugged in here.
Will it always? How are we advancing then?
It'll be a dance on
You're
here.
gonna see what, it'll eventually be doing that though, right?
Yeah,
'cause you're-
once you do show my screen.
Yeah, it'll change. Is Jen participating? We can text her. What do you see? Open here.
Mhm.
Can you hear us? Should I just get out of this?
I'll let her know she can use the one that you sent her.
Yeah. I think she might enter as me though.
Can I just exit
That's
this
okay.
window?
Yeah, because I noticed that like, unless she's in there now, because it says I'm an attendee also. Like, see how it says
Is
there's
that
two
Evan?
attendees? It's Evan and me that are attendees right now, but I'm
But it's-
also in the staff
Oh.
section, so.
Okay, I said show my
There it is.
screen.
So,
Click. I can't see what that says.
so it's showing, like you'd have to go
Make
into the
it
slideshow
bigger.
view.
Slideshow and then try to show your camera too and see what happens, just so we can see you.
Oh, that's the problem.
Well, let's try something.
Because I thought we were gonna try to use that camera.
That's-
so.
Yeah.
Yeah, so, and that's the camera.
Oh, but try.
You can turn her
I
camera
know there's
on.
somebody who you can do that because
Ashley, you might want to open yours back up, but just not have it in front of you because it doesn't show you on
Yep,
the
this is perfect. This is
participant
how it
list.
shows us
Now,
now, except that
are we
now it just
Zoom?
shows. Yeah, if you go into the webcam, it's here, go into the preferences.
Widescreen,
Yeah. So change it.
it does change it.
So yeah, it's that webinar and that screen. So you want to try advancing the slide?
Yeah, but how do I, whoop, I just lost the camera.
So we have, your webcam is not on.
Okay, don't remind me again.
oh, now does it show me in?
Yes.
Okay, so I'll just leave this down here. No one can see it on the camera. We'll have like a,
But we're still seeing,
This is the screen. So Evan has what attendees will see.
and what are they seeing? Not that
No,
jumble?
attendees are seeing this.
Okay, great. So you're seeing what I'm seeing. Okay.
and I'm just seeing this panel.
Mhm.
We want to see
How do we get
questions,
that up
right?
there?
Do we want to see polls in it?
We don't.
Unless you want to, because you'll want to, if you want to run that one poll
I
about,
think you're gonna wanna see chat.
yeah, that's why I have the chat up there.
But we won't, but that's your computer and she's now the organizer. So don't we want to see what Natalie's is up there? Or am I not understanding?
Well, we could.
You can't because she's
Why
plugged
am
in
I not-
directly.
where's
Yeah, I
chat?
see.
But we could plug hers in directly and see it.
Will it reach?
It's this one down there.
Oh. Oh, you can only open one at a time.
Wanna try to
I
use-
think
Yeah,
only-
should reach.
But the problem is you won't get all of us on the camera.
If we keep using this
Yeah, this is still the
camera,
camera. This will just put yours up there. I'm thinking, should we try it? Let's try it.
if that's easier.
Now you should be up. You should be. My voice just went somewhere.
People are attending right now.
I don't know
Just
how
so
to
you
fix
know.
this because now it's. How do I, because now you're seeing my screen.
This is what people see.
Okay. So we don't.
Everyone. can just click here.
I did pop right back up again.
So if you can hear us, we can do a little welcome and then we'll get started in a few.
Welcome for those of you that have joined us already. We'll be starting in just a few minutes. Everyone. Good afternoon, everyone. Good morning for some of you. Thank you for joining us for the Providence House webinar. We're going to talk about impact and opportunity in the transformation of the crisis nursery model today. We'd like to introduce the team that's here with us and then allow you to tell us a little bit more about yourselves. I'm Natalie Leak Nelson. I am the CEO and president of Providence House. I've been with the organization for nearly 18 years. Came from actually not the nonprofit space, so kind of a sector switcher, which plays a big role in the transformation of our organization and our approach to innovation. I'd like to introduce Annette.
Hi, my name is Annette Uemoto. I've been with Providence House almost 7 years. I'm the Strategic Initiatives Manager. I do a lot of work with Providence House in several different areas, government relations and program evaluation. But for many of you who reached out to learn more about the model, I was probably the first person that talked to you.
And I'm Ashley Stock. I'm the Director of Programming and Clinical Operations. I've been with Providence House for 12 years. I'm very committed to the mission, and Providence House is sort of a family legacy for me. My mom actually volunteered at Providence House, and then I interned here and have been here ever since. So I can answer any questions about programming, and we'll be talking about that more as we go through the webinar.
And you'll see the list of attendees on your screen. We also have a poll available. We'd like to learn a little bit more about, where you're at with your position in the crisis nursery world. So Annette, you want to cover some of the 3 options?
Sure, and we'll pull up the poll on here. You can answer on your screen. Go to, if you minimize attendees, give us 1 second, and then select what best describes you, and then we'll launch the poll. So you can either select I work at a current crisis nursery if you're working to launch a new crisis nursery or want to learn more about crisis nurseries. So go ahead and select your response, and we can get a sense for who's in the room today. Great, we'll just give you a few more seconds to respond. So we're gonna go ahead and close that out. Yep, it looks like about 67%, most of you in the room today, want to just learn a little bit more about what crisis nurseries are and what they can do, and we'll definitely be covering that. But we do see people here who are working at crisis nurseries or working to launch them.
So our goal today is to really give you a sense of why we're here talking with you. And over the last number of years, we've been getting questions like this at our organization. I want a crisis nursery like Providence House in my community. How do I do that? I work in child welfare. We need a program like yours. How do I even start? My organization started a nursery, but we have some technical questions about staffing models and child transportation, things like that. Or they're a crisis nursery, but they're not maybe collecting and using data in a way to indicate outcomes and performance or quality or even fundraising. And so we get a lot of questions about our data analytics and how we use that data to advance our mission. So our goals, we have a couple goals today with you, and we encourage you to post chat or questions as we go. If they're related to the topic that we're on, we'll look to those and address them. We also will be pausing periodically just to review a couple of those questions and make sure that we're keeping this as interactive as possible. So first, we want to introduce you to Providence House and what we believe is a pretty unique model in the crisis nursery community nationally. Really going to walk you through our pathway from a traditional crisis nursery, providing emergency shelter to children, to a family preservation crisis nursery, a multi-generational program. Ashley's going to talk to you a little bit about our integrated multi-2-gen approach and our service approaches and philosophy. We're also going to talk to you a little bit about some of our really significant outcomes and impact across a couple different data arrays and research studies. We're also going to talk about some new opportunities for crisis nurseries, convening our group nationally, consulting and coaching services we offer, but also just to put on your radar some of the changing child welfare landscape and legislation moving through the US that could really profoundly advance the crisis nursery model. And we want to hear from you about what else you want to learn, either together from us, from another nursery, so that we're sharing ideas and thoughts and best practices in advancing the crisis nursery community overall. We really wanted to kind of highlight, because we have communication with a number of nurseries or people that are starting nurseries, and no two nurseries are alike. We all get called crisis nurseries or crisis care facilities or whatever your state legislation refers, but we do know that there's an array of services and age groups of children, and the federal definition is actually quite limited in terms of the age of children, birth through 5, and how long they can stay. And state by state, and certainly us here in Ohio, with our 3 existing nurseries, have really worked with our legislative representatives to advance the licensing and regulations in Ohio to give us time to really be a family preservation program, which is quite different from most states' lengths of stay, which don't accommodate some of the services that you're going to hear from Ashley today. Really, the primary focus of any crisis nursery is the prevention of child maltreatment by providing that temporary safe shelter away from the family crisis. And we're going to talk a little bit about those services as they deliver at Providence House, but it's the integration of the family so that the children are safe after they leave long-term, and starts to dovetail into foster care prevention, which Annette will give you some more information on. I just want to take a couple minutes to give you sort of a background of Providence House. We are Ohio's first licensed crisis nursery. We were founded in 1981, so 38 years of service. Been licensed through our Department of Job Family Services since 1990. Over 8,000 children have resided with us since we opened our doors. We have a 30-bed campus in Cleveland, Ohio, and soon to be expanding to the other side of our city and operating a total of approximately 50 beds in the Cleveland community. We are accredited, CARF accredited, Medicaid certified behavioral health provider for children and adults, and really are focused on external evaluation and proving the impact of our services through our data and outcomes. So I'm just going to take a quick second to talk about our transformation as a crisis nursery and some milestone moments for us and times. And certainly 1981, when we opened, we were founded by a sister, a Roman Catholic nun who was retired, saw a need in our community during the height of the crack cocaine epidemic, HIV positive babies being born, addicted babies being born, and nobody knew what to do for these families. And so she started Providence House, along with a number of other communities that launched nurseries almost simultaneously to fill the gap in family support versus removing children. So we started in 1981. We really were kind of the same service. We were very small. We were community-based. We were child-focused only. We had a good reputation for serving children, but really rockin' babies was how people perceived who we were. We were challenged to maintain fiscal stability for full capacity because we were very limited in our work, and we were very locally focused with very limited geographic impact as we were operating. We did expand in 1987 to add more children, expanded again in 1990. And really at that point, we continued to just be an emergency shelter for kids. Families were not engaged in services. We were providing wonderful care to the children, but even some of the clinical and intensive developmental and trauma-informed work that we do with our children was still not a part of our program. That really came into play much later in our transformation cycle. I came into Providence House in 2001, as I mentioned, not from the human service sector, and started to ask really basic questions of, if we're watching these children, how can we return them to their families if we don't know the family received the support they need, not just as a parent, but to move through the crisis, whether it was addiction or violence or mental health issues. And we really felt that in order to say that we were a child's champion, that we were there to keep kids safe, we needed to be working with the family to ensure that that child was returning to a family that had been stabilized, supported through crisis, and had the ongoing community support that they needed. And we really felt that that family preservation focus was the critical missing element for our nursery's success. So in 2001, I came in. By 2003, we started to dabble with parent visitation and some light case management services, some referral and wrap service. In 2005, we really began full-blown parent education, and Ashley will talk about our unique approach to that, and aftercare. So once families were reunited, sticking with them, supporting them, continuing to make sure they were connected to those vital services they needed to stay safe and stable. 2006, we started early childhood enrichment services, and that includes for us not only early child care, but with our school age populations, advocacy and intervention with school systems, and working with kids through homework help. And Ashley will talk a little bit more about some of our other creative and educational approaches. In 2008, which isn't kind of mapped on here, we really began to hold our families very accountable with using a family engagement plan, which Ashley will talk about. So the services at this point until 2008 weren't necessarily required. We asked parents to do them. And what we really wanted was to have parent accountability, to have a very clear sense of our expectation for the parents, and our parents took to it wonderfully. And you'll hear from Annette on some of our data how successful that engagement is with our parents. One of the most critical shifts in our organization came in 2010 with Ashley leading this effort and becoming a trauma-certified, trauma-informed environment for both the parents and our children. And that included all of our staff, all of our volunteers, and all of our clinicians. And that has, again, transformed not just bringing parents in, but the way we work with kids and families. In 2012, we expanded our nursery, brought more beds on campus with this fully integrated model. In 2014, we opened an official family center. So we were doing all of this great work with families education, visitation, case management, counseling, but they were tucked in rooms all over the place. We dedicated a building with living rooms, comfortable spaces that were respectful and appropriate for families and private. And that has been a very successful launch. And in 2015, our latest program, which is a pediatric crisis nursery, same services. These are children who also have medical issues. So it may be acute, it could be chronic. We've got everything from preemies to feed tubes, apnea monitors, up through autism, cerebral palsy, and other developmental disabilities. So our next big move is happening right now, as I mentioned, to a facility on the east side of our city, which will nearly double our capacity for serving families and children in crisis. So that's been our pathway. It didn't happen overnight. And so as we hear from a lot of nurseries that are still doing the shelter work, they say, but we want to do everything that you're doing. And it's a process, and it's a progression. And it took us time to get where we're at, but the movement has been all responsive and all to address the community need and the parent need, meeting them where they're at and letting them teach us so that we could deliver the services that they needed. So Ashley's going to cover some of our service array.
So I'm going to dig a little bit deeper with you all on the services that we provide, and then I'm going to share with you a family story, but I would encourage you during this time to also text in or chat in any questions that you might have about the services as I go through it. So as you can see, our first bullet is really talking about protecting children. And as Natalie walked you through our progression, that was our first core service. It's what we do best and is the foundation of everything we do. But we have been enhancing it over the time that we've existed. So we're providing that safe, nurturing care, free and voluntary service to our families. We're making sure that any medical needs are being met, kind of really providing for that safe, nurturing environment for kids. And then with families, we're connecting them to resources. We're doing case management services for them, really identifying why they're seeking services and tailoring our approach to exactly what that family needs to support them, offering parenting in that same way. So not assuming that all the parents who come to us are bad parents, quite the contrary. They're good parents in a really tough situation. We want to find out from them, what do they need, and customize a plan specifically for them. And then also the trauma services too, as Natalie said, really revolutionized how we saw our families and our role in making sure that they were safe and stable. And then strengthening the community, we definitely believe that working with families, we're returning them to their home environment stronger with more resources and connections. And also we're taking time to educate people about what Providence House does, about the impact of abuse and neglect. So we're not just serving families in the building, we're going out into our community and informing them about what we do. So this is definitely an important slide for you to pay attention to in terms of what we do, but I think a really good way to illustrate it is to walk you through a family story. So I'm going to tell you the story of Jasmine. So she was a single mom who came to us after experiencing domestic violence. Once the domestic violence happened with her young children's father, he left the home, but separating from him and losing that source of dual income meant that she eventually lost her own housing. So she now is a homeless mom with 3 young children, seeking support from Providence House to make sure that they are safe and taken care of while she reestablished herself. This mom was not somebody just kind of looking for the system to take over and take control. She was working really hard with the resources that she had to be successful. So Providence House took the lead in making sure that her kids were safe, but mom continued to work 2 jobs to save money to try to find that new safe home environment for herself and her kids, and also a place for her to know that her kids were safe so she could take care of some of the other things that had been delayed because those basic needs weren't being met. So once she knew the Providence House was taking care of those kids and supporting her, she was able to, reach out for mental health services. She was able to get a protection order for her family, all that while preventing system escalation. So when we worked with mom, we again started to figure out what she needed by her own disclosure. We didn't decide, of course, of treatment or a plan of action without her consent. So everything that we did was based on what she needed. So we helped her find a daycare near where she worked as a home health aide. We helped her apply for a daycare benefit voucher because she wasn't eligible for that with dual income, but becoming a single parent, she was now eligible for that, but didn't know how to access that service. We reconnected her with her own grandmother for some support because she had been so isolated by the domestic violence that wasn't an option for her. And in terms of her parent support, we weren't having her sit down and do things like how to change a diaper and how to do infant massage. Those things weren't what she needed to look at. What she wanted to find out is, how do I establish these really nurturing parenting routines for my kids when I'm working 2 jobs now and as a single parent? So that's what we looked at. We did a home safety inspection checklist so that when she was going out and looking at affordable homes with the budget that we created, she knew what to look for that would be safe for her and her 3 sons. And in terms of the trauma services, we knew that everything that she had been through wasn't just something that she experienced alone. She was experiencing her trauma, but also her family was as well. So we really took into account the fact that the children could have witnessed some trauma there too, maybe seeing some domestic violence, seeing the impact or the aftermath of arguments, and realizing that their sense of safety might have been like a worry for them that they didn't know how to address. And we couldn't just say something didn't happen to you, you saw it, but those things are equally important. We wanted to address the needs of folks who've experienced trauma directly and also witnessed it. So we were able to do a trauma screening with mom, figured out what her kids had potentially seen, kind of relate those to some symptom experiences for trauma survivors, and link them with appropriate therapy that would meet them where they were in terms of their trauma experiences, instead of just making a blind referral to a mental health provider, really trying to find someone who specialized in domestic violence and post-traumatic stress. So we worked with this family for 60 days. Mom was able to maintain her job. She got housing. They got their daycare benefit in place. She discharged with being able to fully meet all of the basic needs of her family. And then she enrolled in our aftercare program. So when families leave the nursery, we want to be really cognizant of the fact that they trusted us with a lot of information. They told us a lot about their lives, and we developed really strong rapport with these families. And we didn't want to just end that relationship when the kids went home. So we offered this wraparound aftercare service for 6 to 12 months to be able to provide ongoing case management support, connect parents to other families who maybe have been through a similar crisis, and really try to do what we can to prevent any families from returning unnecessarily just because they didn't have those resources. So this mom is still engaged with Providence House to this day. She actually had her first daughter and returned to Providence House to let us meet her and sharing her successes with us. And this is the first time she's really felt stable and able to be a mother. And there's a quote on her story too, if you could just take a look at that, that's really powerful and in her own words. So we really do believe that the work we do is important, but it's not just these program elements. It's not just case management and parent education and visitation that makes a difference. It's really our philosophy and our approach to working with families that's that important link to making sure that we're successful. So we do have a slide up for you guys to see about our philosophy. So Natalie already did mention the importance of having a multi-generational approach. We can't just work with the children and expect that to make all the difference. We really want to engage parents and grandparents in what we do. We also have a very individualized approach. So I kind of described it with Jasmine in particular, but we try to offer services that leverage parent strength, that identify any barriers and help them accomplish their goals as they state it, often in their own words, as we develop a treatment and service plan. We're also very committed to data and documentation of our outcomes to see how we can improve what we do. We have to be very open to the fact that our services are unique and can be tailored specifically to what families need, but also to see what's effective and figure out how to drive forward best practices. We also recognize the value that what we do is really a niche in the community, and we don't try to duplicate things that are already out there in the community, but instead we want to partner with other agencies and really build a community that can support families long term. We usually see families from anywhere from 24 hours to 60 days. That's not going to solve all their problems. So we want to make sure that we connect them with other agencies that can really be that ongoing partner with them, knowing that we're still there, but we really see our job as brokering that relationship in their home community. And then we also really acknowledge and respect that our families are coming from a really difficult spot and making a really hard decision to separate from their children. And we have to recognize where they're coming from in order to do the best work. So we actually have a letter that one of our families wrote to us after leaving, which you can take a look at, but it basically says, "You're all amazing. You cared so much for my kids and I. You never turned us away. You never gave up on me. You stood by me when things got hard. You took care of my babies when I couldn't." You can keep reading it, but basically the gist behind that is that mom felt like she had to make this tough choice, and she trusted us to take care of her kids and recognize that we did everything we could to support her, and she knew that in her absence that we could fill that gap temporarily before returning those kids home to her. And the next one is just a lot about our approach of making sure that families feel heard and welcomed. And this mom said, I felt like the scum of the earth the day I brought my children there, but your staff were so warm and welcoming that I wanted to break down in tears, not from separating from her kids necessarily, although she said that definitely played a part, but because she was being treated like a human being that needed help, and really recognizing that humanity of the mom coming to the door and seeking help, and us being often the first door families knock on to get that help, is really the core of what we do, is creating that environment and that culture around respecting our families.
Great. So we shared some of the, what I would say, qualitative results that we receive. We collect parent comments all the time. They have the opportunity on their discharge surveys to say what the experience meant for them, if there were any areas of improvement they felt. But we also keep track of a lot of data, and I've just highlighted a few here that are really main internal indicators for our success. One being that 90% of families last year engaged in services. That means when we sat down with them and talked about the need to visit with their kids while their kids were staying with us, to participate in case management and parent education and trauma services, that they were really following through on that commitment, attending the meetings, visiting with their kids, meeting with those service providers outside in the community. And it's a very high level of engagement for services. We also know that, especially in the community, people feel like if kids are staying with us for 30 days, then maybe that's not a great way for the parent bond to stay connected. But we find that almost all of the families we serve, the parents report that their bond with their child stays the same. And actually 46% of the parents last year actually said that bond improved through our parent education, being able to stay connected with their children, and being able to take care of a lot of those family crises that are really distracting from them being able to bond with their child. Last year, 99% of the children we served were reunited with their parent or guardian. We actually did not have any kids go into the foster care system from Providence House last year. The only children that didn't were discharged with an adoption plan.
And real quick, we had a question that asked if we staff our own case management team and social workers or refer to the community, and we actually do both. So we have social workers on staff that do the case management, the parent education, monitor visits when needed, provide the trauma services, but we're also referring out to ongoing partners to manage it long term. So it's definitely a combination of Providence House doing one part of the work while the kids are staying with us and working with the parent, and then the community kind of taking over after that discharge plan is made.
Okay, and so what we know about our services is that we are really a key to preventing foster care. If you look across the country, 1 in 8 children experience a confirmed case of child maltreatment by their 18th birthday. So child abuse and neglect is pretty common. And the average lifetime cost for one victim of child maltreatment is not on there, but always on my mind, is over $210,000, which means for all the kids who were experienced abuse or neglect last year, that was a $124 billion lifetime cost that we're incurring every year for all the children that experience maltreatment. The annual foster care cost is about $25,000, but if you look at kids who might have medical needs or mental or behavioral health care needs, that cost can balloon up to $91,000. So if we think about the 323 children that Providence House was able to keep out of the foster care system last year, we saved our community over $8 million just in foster care costs alone. And what we're beginning to find is that foster care actually, if you look at how much money we put into it, for every $1 we spend in foster care, it actually costs our community $4. And this is in the best case scenario where families are able to reunite with their kids after fairly short-term stays in foster care. But any of us who interact with that system know that that's not necessarily the case most of the time. So we had been receiving questions from our community and our funders for many years about, well, you say that 99% of the kids that you serve are reunited with their parents, but what happens 3 to 5 years down the line? So we, in 2012, really kind of launched an external evaluation with Case Western Reserve University to look at our data and bounce that against foster care data in our community and see what the results were. We felt that we prevented foster care, but we also knew that by opening ourselves up to this external evaluation, we could find that we were completely wrong. Fortunately, what the study did find was that 82% of the children that we served remained out of foster care. This was even 3 to 5 years after receiving Providence House services. What surprised our researcher was while the families that we serve really kind of reflect what public system use looks like in our community, that the majority of people entering public systems tend to be African American or biracial. But when he looked at our successes, he found that minority families, African American and biracial, were actually the most successful in our program, with the most engagement in services and least likely to have their kids taken into foster care. Also, what we discovered through this survey is what we already knew, that about a quarter of the kids that we serve each year might come back at some point in time. Ashley did talk about how Jasmine had returned to use Providence House, but we become a support for families who might not have a lot of great social community support. So they may come back to us when they need it, and those families are no more likely to see their kids taken away from them. So the study really, which was published in 2016, showed that Providence House has a tremendous impact in reducing foster care. Our model does.
And I think, and Annette can drill into this a little bit more, one of the other questions was not just do we keep kids out of foster care, but which program elements, which service doses were the most significant in the prevention of families from entering foster care. And it really wasn't the kids services, it was the family support services, and which makes a lot of sense because we're stabilizing that caregiver and home. But I think it's an important note in what we view as a traditional crisis nursery model, which is sheltering kids, but the real impact of the work to prevent foster care is the work with the families.
And going into more kind of external evaluation, some conversations we've been having at Providence House over the past couple of years is how our model and the services we provide really intersect with public health goals and address social determinants of health. And I'm just going to do kind of a brief overview in case anyone on the webinar is not familiar. But when you think about healthcare, most people tend to think about those clinical medical care that help you stay healthy and support your well-being. But what researchers are beginning to find is that that really only accounts for 20% of a person's health and well-being. The other 80% really come from the environments that we live and grow up in, the social and economic factors that surround us, and the health behaviors. Those are what are really driving our health. And so we began to have these conversations, and then we had a really interesting and great opportunity to participate in another external evaluation where a group from the Big Gun Center at Case Western Reserve University looked at a lot of our internal data and did some data analysis. And what they found was that families showed improvements in many of the areas that touch on social determinants of health. Things like children being enrolled in school or daycare programs, the housing stability, although we know that's a huge barrier for many of the families that reach out to Providence House for support, increased employment, and also tied to that income. So our average income for a family coming to Providence House is $618 at admission. That increases 33% to $822 at discharge. And for families who participate in the aftercare program, that mean income increase shows a 50% improvement. So while families have their children with us, they're able to really advance themselves and achieve some of those great family stability indicators. And I'll just touch on the fact that children who receive services at Providence House do get a well child exam within 5 days of admission. And so that's the majority of the kids that we serve. It's a chance to catch any undiagnosed conditions, catch them up on vaccines. And in our pediatric crisis nursery, helping kids with medical needs, we've also seen families who become disconnected from medical supports because they are so distracted by the crises that they're facing that they're not able to address all of the issues facing their child's health. And so we're doing a lot of that reconnection service, which was not really one of our anticipated goals in opening the pediatric crisis nursery.
We're going to pause to see if there are any other questions that we've been answering as we're going. I don't see any others posted currently, but we'll keep an eye on that as we go. So if you do have questions, just or anything you want to chat, you can enter into the chat or the Q&A. And I guess we'll just keep going. So we really want to focus on those new opportunities for crisis nurseries, and there are many. So Annette is going to really kind of walk you through some changes in the landscape, some opportunities that we see coming down the pike for crisis nurseries that we really want to raise your awareness of. And then we'll move into a later discussion about how we can convene and support one another and maybe capitalize on some of these opportunities as a nursery community.
So what I put up here, I receive a daily email from Child Welfare Information Gateway that really just goes through headlines kind of around the country touching on child welfare. And these are just some headlines I found from the last couple of days. And it's really showing that our foster care system is in crisis. Many of you probably have seen this in your own communities or have read these headlines, similar headlines in the paper, that we're struggling to find enough foster homes for kids who are entering care. There's not enough funding for child welfare. And the staff that works in Child Protective Services have huge caseloads. There's huge turnover in staff. And many of those who are working there have high levels of secondary trauma, even to the level of post-traumatic stress. So what we know is that we have a system that is really stretched, and we're beginning to see growing recognition that something needs to change. We need to do things differently. Providence House is honored to receive the Children's Bureau Champion Award this past April at the National Conference of Child Abuse and Neglect. I attended that conference and got to meet with many of the leaders in the federal government and people from across the country who are really committed to this issue. And the overarching messaging at the conference and what people were talking about in the room is that there needs to be more focus on prevention, more funding, and more support for, if not prevention, early intervention programs. And we really see that this is a role that family preservation crisis nurseries can play as we talk about this changing landscape. And just to reiterate how family preservation crisis nurseries can help, we're protecting children in a safe, licensed setting, but beyond that, it's very home-like. If you ever have a chance to be in Cleveland, we'd love to show you around to show just how warm and friendly the environment is. We know that families fear that if they reach out for help, their kids are going to be taken away. It's why Providence House is so successful. It's one of the first questions parents ask us is, you're not going to take our kids away. And they hear from others who've used our services that, in fact, Providence House helps them get back on their feet and regain stability. We see the parents as the expert on their children throughout their child's stay. So knowing that they,
hang on, we're trying to do too many things.
and we are able to, through our programming, really create safe, stable, self-sufficient, resilient families by partnering with those parents. With our goal to really break multi-generational cycles of abuse, neglect, and system involvement. As all of you know, foster care is a reactive solution, but Providence House and other crisis nurseries can be there before maltreatment occurs and prevent crises from escalating.
And one of the questions that I was just trying to type in, but had a little snafu, just talk about how clients are referred. So we didn't really touch too much on that, but our parents and guardians are about 70% self-referred to our program. But we do take referrals from any kind of community partner you can think of. So schools refer, hospitals, mental health providers in outpatient settings, a primary care physician. So we'll take a referral from any source if there's an identified need, and then we try to screen everybody through and see who's a good match. And if you're not, we'll find someone who is for you. We'll do our best to coordinate services, but the referrals can come really from anywhere, but most of our referrals come directly from the head of household who's in crisis.
And that question specifically also talked about the homeless population and coordinated intake.
So in our county, we have a coordinated intake approach to housing where families are supposed to enter kind of through one door and then get sort of routed out to the best place for them. Because we know we're separating parents from children, we are really the provider that they look at when families who are homeless can't get into family shelters or overflow shelters together, or if it's not safe for them to do so. So sometimes newborns, it's better for them to be with us than in a shelter situation. Some kids with behavioral or medical needs are better suited for our situation and our services than being in shelter, even though they are having to separate from their primary attachment figure. So we really work with families to determine what the best sacrifice is there. So whether it's that they're going to stay in the shelter situation or they're going to separate from their kids and make this decision that works best for them given their unique needs. But we do serve families for a variety of reasons, which we also haven't really touched on, but anything from outpatient mental health, inpatient mental health, substance abuse services, if a parent has to serve a short-term incarceration, medical needs of a sibling, chronic medical needs of an adult, unsafe living conditions, so anything from lead to rodents and pests, community violence, domestic violence, and anything that puts a family at risk or kids at risk of abuse or neglect. So we don't have boxes that you have to necessarily check off in order to use our service, because we want parents and guardians to be able to identify what makes them feel unsafe and determine what's a crisis for them, and then figure out how we can intervene.
One more question that came through was, do we provide transportation to school?
So we do when we can. So we don't have geographic restrictions around where our kids and families come from. So we do our best to coordinate transportation with our own staff in our own vehicles, our Providence House vehicles. But also we'll work with the Department of Transportation. If they have IEPs, they'll pick up. And then our parents are also our partners in that and make sure that their kids make it to their home schools. Because we try our best not to transfer them to a school near Providence House if they don't live near us. We want to have as the least number of disruptions in that child's life as possible. But then also on transportation, we do offer bus passes for our families too, so that they can get to us.
And one more, our screening is our screening process more judgment-based or specific criteria?
I don't know if that asker could give a little bit more detail, but I would hope that none of our services are very judgment-based. So we're trying to be very open-minded, client-centered, and offer everything that we do with dignity and respect for the family. But like I said, there aren't a lot of hard and fast rules that would screen people in or out for services aside from having a child birth to 12 and being in crisis.
We're going to advance now to an upcoming opportunity that's been presented at the federal level. We'll keep an eye for questions, and then that's going to give us an overview on the Family First Prevention Services Act, which was passed in fall of 18 by Congress.
Yeah, so the Family First Act, really what it does is redirect how we use Title IV-E funding. Currently, most of that funding, I don't know why that says Title VII, right? But Title IV-E funding currently is used for board and care, foster care services. And what Family First does is really offer the opportunity for states to use that funding to prevent families from entering foster care. It also puts a number of restrictions on residential treatment settings. The money is actually available starting this year, but many states are choosing to defer the funding for 1 or 2 years while they put together their plans to meet the new restrictions on residential care and set up their prevention services program. The legislation also launched a clearinghouse to house different prevention programs that states can use to put together their plan for programming. And Providence House has been following this legislation. We actually submitted comment last summer that family preservation focused crisis nurseries should be included in the clearinghouse. And we've been receiving some feedback from Senator Portman's office on how we can help advocate for crisis nurseries to be included, because while many of the programs in the clearinghouse kind of have that evidence-based designation, there is room within this legislation for more innovative programs. So we have submitted this comment. We've worked together with our other fellow crisis nurseries in Ohio to advocate to our governor to help us in our efforts. And he has submitted a really great letter to Health and Human Services advocating on behalf of our crisis nurseries to include the model in the clearinghouse. And now we are reaching out to other crisis nurseries from around the country to also ask their governors to do the same and also sign a joint letter with us. And sorry, would you like to take?
Yes, so we sent an email out to existing crisis nurseries and other interested parties. So if you did not get the email from me probably 2 weeks ago or so now, let us know, post a comment or shoot an email to Annette or I. Our contact information will come up and we can forward that letter to you. The letter has links to the actual handbook and some clearinghouse information, sample letters, as well as the joint letter that we're hoping all crisis nurseries and interested parties looking to launch nurseries can sign on together to advocate together that the clearinghouse does include family preservation nurseries.
Yeah, and I will add that there's going to be a survey after this webinar ends. It should show up on your screen or in your email box to talk about how you want to stay connected to us. And there is an option on there to join our advocacy efforts in Family First. So if you're interested in learning more, just select that and I'll be in touch.
So as we kind of come to the end of our presentation here, and we will keep checking for questions, what we're really hoping that the result of this is you feel like you know a little bit more about the crisis nurseries and nationally, kind of as a landscape. There are about 60 operating nurseries in the United States currently. As those of us who are operating nurseries know, we're all very disconnected and independently operating. We'd really like to convene the group. We'd like to build a coalition, advocate together, learn from one another, provide technical assistance. And then in addition to that, we've been approached and currently are assembling an array of supports that we can offer to not only existing nurseries, but those that are interested in opening nurseries in their community. And we'll talk a little bit about who we can help and how we can help in just a second with coaching and consulting support. So I'm going to have Annette kind of talk about our primary target audiences that we really think we can add a lot of value pretty quickly in the community.
Yeah, and many of you talked to our thought partners Thrive at Work as we were kind of discovering what the landscape was out there and what services we could provide to help others. And what we've discovered with them is there's kind of 3 main groups of people that we can help. Those include people, one person, a small team, or a task force who really want to launch a crisis nursery in their program, in their community. There's also existing crisis nurseries. Some of them are just getting started and are seeking stability. Some are looking to grow their outcomes and maybe see some of the successes that we see. And some of them are just crisis nurseries like us who want to connect with other nurseries. We also have been getting a lot of inquiries from other task force, health systems, public agencies that just see the need for a crisis nursery in their community, the gap that it can fill, and we want to be able to provide support to help them get there.
So, and that's going to talk to you a little bit about the startup work that we have done with some other folks and are available to do.
Yeah, so we have gotten a lot of inquiries from people who want to start their own crisis nursery. And some of the ways that we're able to provide support, we can do stakeholder presentations. So help you talk to leaders in your community about the role crisis nurseries can play, talk a little bit about our model, the challenges we see, and successes that we're able to achieve. We've been doing these in Toledo and Columbus, even San Antonio. So definitely something that we're willing to help you with. Also, feasibility assessments of your community, looking at potential locations, who are those service and funding partners, what does licensing look like in your community to help you get on track to be able to launch a crisis nursery. And what we've started doing is a startup assessment that helps us understand what you have already been able to accomplish, what your strengths are, what you feel like you can, what tasks you can complete on your own, and what areas Providence House might be able to provide some support and help with. And using that kind of assessment to help you create a plan to get funded and launched. And we will provide tools and resources along the way to help you get to that.
And that, while you're on the subject, a question came in, approximately how long from the inception of the idea to the launch of a crisis nursery?
So I think there could be.
The question we always get asked, how soon?
It can be a really wide range. It kind of depends if you're someone who just has the idea. It might take a year or two just to convene the right partners around the table to really understand what the model is, to get the right kind of the people who know how to pull strings to get money and support and funding to be able to launch the crisis nursery in the community. If you have a good dedicated task force and you're well along the way of knowing who the funders in your community are, it could be as short as maybe a year to really go through all the steps and get in place to be able to launch. So it really is very dependent on personal situations.
Yeah, and also one of the things that we're seeing too, and it kind of goes into, almost trickles into the current crisis nurseries, is we do have some partners that we're working with that actually are already entities that are operating nonprofits delivering services. It may not be specific crisis nursery services, but we do have a group that we've talked to in the Akron area of Ohio, and they actually run a shelter a women and children or women's shelter, women's children's shelter, and then another organization that runs a youth shelter. But these crisis services are becoming more prevalent when moms can't be with their children in those shelters. So they're adding on components of the crisis nursery service. So that's a little faster to launch. They've got funding partners, they're up and running, they have an organizational infrastructure, versus some of our other partners where, to Annette's point, it might be 18, 24, 36 months because we really have to build the whole foundation from the ground up. We also get a lot of inquiries from our current crisis nursery partners across the US, and we really are able to provide learning curriculums around specific needs. It could be funding, funding strategies, funding diversification, fundraising ideas, and donor development and cultivation. Technical program service areas like our trauma-informed care and certification, outcomes measurement and evaluation, and what should you measure, can you measure, how do you report that? Staff, volunteer management, we get a lot of inquiries around board development, governance, coaching. So really everything from infrastructure elements to direct service elements to those elements that position your organization in the community for reputation, funding, etc. We also do individualized coaching, so you're working directly, usually by phone or through a Skype session, specific with the technical expert on our team. So if it's data outcomes, you may be on a coaching call with Annette, services with Ashley. I do board and fiscal management coaching. So these are some of the idea areas of where we do this coaching, and then technical assistance. And so this is really those troubleshooting calls. How are you staffing 24/7? We run a different kind of staffing model than most 24/7 facilities, and we found it benefits retention, attendance. It doesn't create staff burnout that we were seeing in a traditional 3-shift schedule model. So we get a lot of questions around that, and we can provide technical assistance on those specific elements, including compliance reviews, licensing, guidance, etc. And Ashley's going to talk about our goal for nursery community.
I'm most excited about this. Our goal is really to create just this community of crisis nursery providers and people who work in this field. We know that what we do is so unique, and working with families in crisis is hard. And I just think the idea of having an online community and a way to increase communication between crisis nurseries nationwide would be so wonderful to have, where we could talk about all of our goals, any barriers that we have with the families that we serve, talk about any new innovations in our community that might help other nurseries perform better. And this could also just be that way to kind of connect the providers who are doing such a wide variety of work, but really might have different programs that are meeting their communities differently, and then to help any of those startups. We might not have the best advice for somebody who's opening a crisis nursery in a rural area, but there might be a nursery who has some feedback on how to help family engagement where there isn't a lot of public transportation. And this platform would be a way to do some of that, which I'm really excited about. It also could be a way to, discuss what's happening nationally, any ways that as a group we could collectively advocate for crisis nurseries, kind of share research, come together and do research together as, like the landscape of nursery providers. And then obviously that would be a way for us to deliver some of the web-based coaching through that community.
So with that, stay tuned. We hope to bring more news about this platform to you, how resources we hope to be digitally delivered to you in the future can continue to help you learn with us. And we learn from you. And we want to know what else you want to learn. So as Annette mentioned, there will be a survey coming, and we hope you'll give us some ideas. Our goal is to really kind of be meeting with you in this way on various topics of interest for you, continue to keep all of our nurseries connected and communicating. So if you know someone that wasn't on the webinar today, be sure to tell them about the next one, and let us know what else we can offer to you so we can all learn together. Annette, you have anything else?
I don't think so. We'll monitor to see if any more questions come in that we can answer. And I will also thoroughly make sure that we answered any questions. So if you had a question earlier that didn't get answered for whatever reason, maybe it got sent to one of us who doesn't have it open in front of our screen right now, I'll make sure that we reach out to you. And you can also use that survey opportunity that should pop up once the webinar ends to ask any additional questions. You can see our email addresses up here if you'd like to reach out personally to get some more questions answered. There's a way on our website for you to reach out as well. It's just provhouse.org.
And I think so far what I've seen on the questions we've answered, but I thank everyone for joining us. I hope you found this valuable. Please give us your feedback, certainly about how this webinar was for you, if you got everything out of it you hoped, if there's anything else we can offer to you in future sessions, and let us know how we can help you and learn together. Ashley.
Thank you so much. We're really excited about this opportunity. It was a pleasure to speak with you today.